Good morning. I'm Dr. A. Nayyar, Associate Professor in Physiology, and I will be talking about aging. This has been my favorite topic, and I'm sure it's favorite topic of many of you. At least this topic concerns everyone. Whenever anybody talks about aging, people do give good ears to it. Now they say that everyone who is born is bound to die. Everyone who is born first grows, matures, reaches its peak, and then starts declining. This downfall from the peak means you have started your journey towards death. This is called aging in layman's language. This world is so beautiful and life is so attractive that nobody wants to die. In fact, nobody wants to age because aging donates your journey towards your final destinations, which everyone wants to either postpone or avoid. Let's try to understand what are the changes which decide your aging so that if you want, you can prolong your stay on this planet. In other words, so that you can postpone your aging. So, we'll be talking about physiology of aging. Now, what is aging in scientific language, senescence? All post maturational changes and increasing vulnerability individuals which they face as a result of these changes. We'll be talking about all this. Now, these changes they induce group of effects which lead to a decreasing expectation of life with increasing age. So many factors influence aging, and studies about aging, approaches, especially scientific approaches about aging, are also influenced by civilization. Culture, it not only influences personal perspectives and family living arrangements, but it has influence also on the way that scientists approach aging and death. For example, Western medicine, with its greater emphasis on curative rather than preventive medicine, has a different outlook. An Indian approach, Indian science is basically emphasizing yoga. It has a different approach. So, in different sections, we will be covering both what Western scientists have to say and what Indian yogis point out. Personally feeling, I agree more with my own culture. But here, choice is yours. Whatever you want to do, whatever you want to choose. I'll be giving you both the approaches, both the options. First of all, aging is not a disease, it's a physiological process. You are born, you grow, a child learns to cry, social smile, crawls, walks, bones grow, beautiful men and women are produced, they reproduce, and then finally they start aging. Finally, when their stores are depleted, certain changes, certain organs, certain tissues in their bodies get tired, then they start towards the final destination. So, aging is not a disease, it's a natural process. It occurs at different rates among individuals, within individuals, and it does not generally cause symptoms. We will discuss the characteristics of aging. Like I said, aging characteristics are not called symptoms, they are features. We'll also review various theories of aging and we will try to explore the effects of aging on different organ systems. Scientists all over the world are working on it. Different corners of this planet, people with keen interest are working on it, and the target is to prolong the lifespan. Because with our efforts, we have made this planet so beautiful, so attractive that whosoever comes here doesn't want to leave it. Now, what are the features or characteristics of aging? Environmental genetic factors, they influence the rate. Mortality increases exponentially. Biochemical composition of tissue changes. Physiologic capacity decreases. Ability to maintain homeostasis decreases. Susceptibility and vulnerability to disease increases. There is loss of physiologic reserve and decreased homeostatic control. And these factors, they result from persistent activation of normal neuroendocrine, immune, and autonomic responses to stress, that is allostatic load. With it's a sad factor to know that with increase of civilization, commercialization has increased and stress has increased. Like you buy a fridge, you buy any machine, any electronic gadget in your house. It gives you service, your car, it gives you service for few years. And then you plan, you decide कि बहुत हो गया, अब चेंज कर लेना चाहिए. अब ये उतना काम नहीं कर रहा. Similarly, dear friends, your in endocrine, your neuro, your immune, and your autonomic responses to stress, they also deplete your stores. After all, everybody is not born with वरदान of अमरता. बैंक में पैसा जितना जमा है, खर्च करते जाओगे, एक दिन तो खत्म होगा ना, unless you keep on putting constantly. Then, altered response to physiologic stresses is development of homeostenosis. These are chief factors, in fact, alarming factors in the process of aging. And sadly, these changes are most of the time irreversible. Now, theories of aging. There are multiple theories. So many scientists have given different schools of thought, and all seems to be convincing. Oxygen converted during metabolism, it causes protein, lipid, and DNA damage over time. Now, oxygen is a very strong factor in your life-threatening situations. It gives life. It's essential to carry your. It's essential to sustain life, to carry out the metabolism in your body. But if there are free radicals, they can't sit idle. They have to attack something and they have to do something, some khurafat. So they start damaging your protein, your lipid, your DNA, and they start damaging your resources, your reserves. Now, the factors which are in support of this theory are mutations in oxidative stress pathway. This can extend lifespan. Scientists have worked on it. They have worked on primitive animals and even some human volunteers. They have benefited from it. Mutations in other pathways that increase longevity, it resists oxidative damage. But there are few factors, people who don't support this theory, who are against it, they say that antioxidants do not delay aging or disease. Then, chromosomal alterations. Age acquired chromosomal instabilities, they contribute to gene silencing or expression of disease related genes, cancer genes. Now, what are the factors which support this theory? As I talked about it earlier, damage by free radicals, it causes mitochondrial DNA or mDNA, mtDNA mutations in muscle and brain. Mutations are very tricky and very unpredictable. They can do wonders in positive or negative way. And in fact, they are responsible for the present form in which you and I are here, from primitive organisms to Homo sapiens. It's all mutations, constant evolution. Defective mitochondrial respiration and further oxidant injury, it creates a cycle of damage which further precipitate negative changes and perpetual cycle ultimately incites disastrous changes. Mitochondrial mutations and defective respiration, they have been linked to neurodegeneration. But here again, there are few people who have something to say against it. They say that the practical impact on non diseased aging appears to be minimal. Immunologic. time acquired deficits primarily in T cell function. This increases susceptibility to infections and cancer. Now, each time you get infection or some disease, part of you die. With development of science, with development of antibiotics, medicines, the branch of medicine has reached a stage where once called deadly diseases are also fully treated now. But in the process of treatment, when you are recovering from it, a part of you die. It's just like an enemy attacks your country. Your army wins over it. You are well armed. You have latest weapons and you defeat them. But few soldiers always die. No war is won without shahadat, without death. So some loss is there. So time acquired deficits, they primarily in T cell functions. They increase, they make you prone to infections and cancer. That is because some diseases are associated with aging. Again, the opposition party has something to say for this too. That is, immunologic function is apparently not directly related to healthy aging. Neuroendocrinologic. Now, hypothalamic and pituitary responses, they are altered. Pituitary, you all must be knowing, is master gland. I call pituitary as a prime minister in India and hypothalamus as president. Though people say it doesn't have much say, but it does. It interrupts only in most crucial matters. No direct support as causative of healthy aging. Supplementation does not alter aging in humans. Genetic. Most, rather more than 80% of the people, scientists all over the world, agree to it that it results from activation or suppression of specific aging genes. So it has a very strong genetic component. And I've seen, not only I'm sure you all must have seen, that in some families, people don't cross 50. And in some, even centuries are enjoyed. Long life, it appears to be strongly heritable. Some genetic disorders, they lead to accelerated aging. So this further goes in support to the fact that genes have a very important role to play. Again, opposition party has to say that evolutionary pressures appear to select for reproductive fitness rather than senescence, and little direct evidence of genetic programming of senescence in humans is known. I agree to the first part because evolutionary changes or mutations are not only influenced by internal factors. If the living beings have reached this stage from single cell amoeba to Homo sapiens like you and me. There were not only internal factors, internal drastic changes or disasters or blasts, external factors also played a lot of role in it. So if I have to cast my vote, I'll cast for in support of it. Cellular changes. There is loss of proliferative potential. And dear friends, this topic is the burning topic of today. In many universities, this is being taught. In many parts of the world, this is the latest thesis topic people have taken. It's a matter of interest, and this seems to be leading. Loss of proliferative potentials like slower onset of lymphocytic proliferation, diminished cloning efficiency of individual T cells, and fewer population doublings of fibroblasts. Proliferative potential does not invariably diminish with age, and changes in gene expression, signal transduction, and telomere length, they contribute to cellular aging. Now, here I would like to mention something about telomere. Telomere, this is a part at the end of chromosome. Each time your cell divides, your chromosome loses a part at its end. Till this telomere or this tail is there. Popularly, our teachers used to call it tail. Till it's there, it sacrifices part of it and saves your chromosome. So your chromosomes are fit for further divisions. Finally, a stage comes when telomere completely vanishes. And then, in next division, a part of your chromosome dies. When this happens, cell dies, and then this cell is not able to divide. Misfit, it dies and is thrown out. This is a very important factor in aging. And an interesting factor here is that this tail or telomere can be regenerated. It gets regenerated by an enzyme telomerase. Interestingly, this enzyme, its synthesis or its activation depends not only on biochemical factors, that your biochemistry should be correct, your electrolytes, your glucose, and all other factors, your physiology, your hormone levels should be appropriate, but also on emotional factor. Ultimately, all the orders come from brain, from CNS. It has been seen in several studies that all those individuals who love themselves, the signal, remember, comes from your brain, your central nervous system. Those who love themselves, the message is conveyed and telomerase is activated. Those individuals who slowly, gradually get detached and stop loving themselves or lose interest in life, activation and synthesis of telomerase is decreased in those. That's why you must have seen in many Hindi movies, कि डॉक्टर सेज कि इसकी तो जीने की इच्छा ही खत्म हो गई है. That's fact. Those who want to live will live. Those who don't want to live will gradually die. Suicide commit करने की जरूरत नहीं है. आपकी टेलोमेरेज धीरे धीरे कम होगी आपके क्रोमोसोम जल्दी खत्म होंगे या यू विल डाई सून. सो रिमेंबर, हालात जो भी हो, वट एवर, wherever life throws you, stop hating yourself. This is called willpower. Will to live. Love yourself. Like yourself. I hope you all don't confuse it with self respect or false ego. Loving yourself is different, ego totally different. So don't confuse yourself, but love yourself and love your life. Now we come to age dependent problems with apoptosis. This could result, which could result in leukemias, lymphomas, and abnormal tissue repair. This may play a role in age-related neurodegeneration. Now, for example, neuronal loss in Alzheimer's. It may be due to cytotoxicity of beta amyloid, which can induce apoptosis in cultured cells. Certain toxins, putative toxins like free radicals, they have been implicated in neuronal loss in Parkinson's disease also. Aging occurs in all the species, but we will be focusing our concern on mammalian aging mainly. Physiology is just like a big, deep ocean. You can't reach its depth, you can't reach the lower end. So, we'll try to understand it in bits and parts. So, the first comes mammalian aging. Here, there is cellular and physiologic deterioration. Then there is increased mortality with age following maturation. Like I told you earlier, that whosoever is born first grows, youth, and then middle age, child grows, becomes adult, stays at plateau, and then downfall. Increased vulnerability to disease. Then there is decreased ability to adapt to stress. As a young student, as young boys and girls, you do adapt yourself to so many stresses. Professional stress, medical syllabus has been proved to be the toughest of all till date. So your studies, your duties, increased demands, and all of us do have some domestic problems, stresses also. We all get a share of our own destiny, our own part. So, in young age, even if you adapt yourself to stress, your cells, your body regenerates. But this process, this ability, when you start aging, this capacity starts decreasing. Now, normal aging can be classified as optimal, best example, or idealized. Usual, most common. universal, which is seen in all the humans. All are influenced by genetics, lifestyle, socio-economic status, physiology, profession. You'll be surprised to know that in West there are still some countries where people happily live till the age of 130, 145, 150. It's my personal experience. I worked in several countries. When I was working in Libya, second day of my job, I got a patient for vaginal hysterectomy whose physiology was to be studied. That was a thesis topic for somebody. One of the postgraduate student of physiology was doing some thesis on it. A 105-year-old lady, nicely dressed up with matching bangles, walked into the OPD. I couldn't believe my eyes when I saw this lady walking gracefully, no deficit in gait, no deficit in walk. And she was perfectly wearing matching dress, matching accessories. And I was shocked to listen to her concerns. Love of life. This is called love of life. And this is what prolongs your age, your lifespan. Aging, is it a disease or is it non disease? A physiological, natural process. Is it usual, non disease? Most of the people do believe in usual. And and that's been more successful. If it is non disease aging, non pathological aging, you age naturally, then your aging is ideal and successful. There's a beautiful poem, I'm forgetting the name of that writer, very old, it was written somewhere in early 19s. It used to be favorite of my father. That nature wants to make a man or shake a man. Nature wants to kill a man or drill a man or like if any of you can find it in Google. It's a beautiful poem which beautifully explains the laws of nature. So if you are aging naturally, you are more that's you have led your life more successfully. Now, senescence or old age or aging, it differs from other biological processes. Why we don't? There are people who call it a disease. There are people who don't believe in calling this disease. Majority doesn't call it disease. Why? Because it differs from other biological processes. Its characteristics are universal. Changes come from within the individual. When you get infection, whether bacterial or viral, you hire it from atmosphere or your friends. Tuberculosis you get from family or friends or your patients. COVID from your alliances, whosoever comes near you. Food poisoning, you eat some dirty food or you drink some infected water. You acquire them from outside, from people around you, from your surroundings, or from atmosphere. But here, the changes come from within the individual. And then The associated processes, they occur gradually. You are able to run fast. You are able to run and cover long distance. Slowly, slowly, your speed decreases. Gradually, your capacity decreases. So these changes, these processes, they occur gradually and slowly. And if they occur at a rate or in a trend that they are occurring to other people, you accept it. Very few people go for ideal, or very few people focus on or concern their attention towards the ideal path. सबके साथ ही हो रहा है, ये तो इसके साथ भी होता है, वो उसके साथ हुआ, उसकी मामी के साथ, चाची के साथ, तो माँ आपके साथ भी ऐसा. Like most of the time, this is the explanation given. These changes have a damaging effect on the individual. Now, what is the clinical approach from usual to successful aging? Usual is जैसे कि बहती धारा में बह जाना, जो चल रहा है उसके साथ हवा के साथ चलना. आइडियल इज कि अगर वो सही नहीं है तो उसके लिए कोशिश करना. So from usual to successful aging, what should be the clinical approach? Normalizing. सब कुछ सहज तरीके से होना चाहिए. Help patient to understand what they should expect. Adjust to likely changes, that is sleep wake cycle, bowel regulation, balance, benign forgetfulness. Benign forgetfulness, it seems quite convincing because when you are born, your cerebral hemisphere, your neurons, they grow in first 5 years. They grow to maximum and then they start storing information. So many things depending on your interest. They store more in which you are interested. Slowly and slowly, the space gets filled. Gradually, you reach a stage, even if you are in perfect good health, you are following sattvic lifestyle according to the yogis. Even then, जब पूरे के पूरे खाने भर जाएंगे, उस वक्त कुछ नया रजिस्टर करना है, तो पुराने बिन्स खाली करने पड़ेंगे ना. डब्बे नए तो नहीं बनेंगे 5 साल के बाद. बट नेचर, where it's cruel, it gives little concession, little discount also. लिहाज भी करती है. It has been seen that in a disease or accident, trauma, or in disaster, if you have lost maximum of your neurons, the remaining neurons can be made to develop so much that they can easily take functions of the damaged cells. It's a harsh fact, cruel reality, कि सेल्स एक पर्टिकुलर एज के बाद रीजनरेट नहीं होते. अगर न्यूरॉन्स डैमेज हो गए, यू आर लाइंग ऑन ओटी टेबल, हाइपोक्सिया हुआ, कुछ सेल्स डैमेज हो गए, रीजनरेट नहीं होंगे. दे विल नॉट बी रीजनरेटेड. बट एट द सेम टाइम, रिमेनिंग सेल्स, इफ यू वर्क हार्ड, हिंदी का एक मुहावरा है, करत करत अभ्यास के जड़मत होत सुजान, रस्सी आवत जात से सिल पे पड़े निशान. सो प्रैक्टिस मेक्स वन परफेक्ट एंड अंग्रेजों ने भी बोला है कि जीनियस इज 1% इंस्पिरेशन एंड 99% perspiration, आपका पसीना. So here, let's try to find out positive factor in each disaster. So adjust to likely changes, right? Then identify potential symptoms of disease like sleep apnea, depression, hypothyroidism, gait disorder, cognitive impairment. I was talking about the bins getting filled. When they are filled and you want to register new information, you have to empty the old bins. Then only. So this is very natural. Now, usual to successful aging for clinicians. You have to maintain or improve modifiable causes of age related change. There are some factors, some causes which can't be modified, which can't be improved. Nature decides them. But at the same time, there are some factors which are in your hands, which you can easily modify. You can change. You can very well control. Now, the main factor which children studying or the youngsters studying in medical colleges face exposures, UV radiation, noise, noise in wards of patients crying, UV radiation, wear your aprons, protect yourself, respect the barriers and follow them. Then, social isolation, psychological well being. People who detach themselves from society, they are more vulnerable. So remember, even if you don't feel like, don't cut yourself off from your friends, from society. Do meet your friends. Go and attend all the social functions. Few, if not all. Keep your mind active. Cognition should be preserved. Nutrition, that is very well in your hand. Well, taste buds, they also demand good food to satisfy them. Don't ignore, but learn to draw lines, learn to put a limit to everything. Now, cholesterol, sodium, calcium, all these levels must be maintained in appropriate range. Majority of people think cholesterol is their biggest enemy. And when they go on diet, they try to cut it off to such low levels that they suffer from setback. While studying physiology, you all must have come across a chapter of hormones, and you know that how important it is for in the synthesis of hormones and how important hormones are for your normal physiology. So try to keep your nutrition in a balanced range. Food should be colorful, tasty, there should be variety and nutrition. Of course, nutrition. Eat lot of fiber, all time evergreen friend. But do eat other things also in required range, required limit. Exercise is not to be forgotten for your balance, for your strength, for your stamina, for your fitness. Exercise is very important. Most people, they live nowhere near their limits. They easily surrender to accelerated aging and early deterioration. They give aging a bad name. If any of you is interested in mythology, you must have read Bulle Shah, who has written many kafis, many Sufiana poems. He lived till the age of 234 years. So one can live that long if you follow the norms. And I'm sure 234 years is quite a good time to enjoy and satisfy yourself with attractions of this planet. Now, what are the age related physiological changes? Everyone ages, but not in same way and not at the same rate. At the age of 75, an average person as compared to age 30 will have 92% of brain weight unless you have suffered from some damaging disease, some hypoxia during your lifetime, some hypoxic insult during anesthesia or any other trauma. 84% of basal metabolism, 70% of kidney filtration rate, and 43% of MBC, that is maximal breathing capacity. Though they say that we are not the people we once were, but this is very encouraging and very ideal that age 75, if you have these features. Sadly enough, most of the usual trend is the most of the people don't have these parameters even at the age of 60. They are worse. Now, what we intend to learn, what we intend to, what should we focus, what should be priority in our learning? Distinguish the usual from successful aging. Successful aging is far from your imagination. Like I said, I described the parameters. Usual is that even at 55, 60, most people have parameters below than this, less than this. Describe the major age associated changes in human physiology. Try to understand anti aging effects of exercise. I told you Bulle Shah, who lived to 34 years. Libya community who easily crosses 105 or 110 years, 130. They walk. Leave besides these people. Pak occupied Kashmir. There is a community, Hunja community. This community, men and women, are very beautiful. Unfortunately, this part has gone to Pakistan. The ladies are so beautiful, so healthy that they produce children till the age of 65. Their menopause comes at 68 or 70. Their men are able to produce children at till the age of 90. This is fact. They live long. Lifestyle is absolutely different. There are many factors, but one of the prominent factor is that they walk at least 15 to 20 kilometers daily. Transport facilities are very primitive over there. They walk wherever they have to go, they walk. They don't use four wheelers or two wheelers. This is luxury. They live in a different world. They walk. Bulle Shah used to walk from morning to evening. बकरियां लेके चराने जाते थे. चरा जंगल में चराते चराते वहीं बैठ के सूफियाना कविताएं लिखते थे. वहीं कुछ जहाँ थक जाते थे बैठ के खाना खाते थे और फिर लौट के वापस आते थे. So exercise has a very important role to play in anti-aging mission, better than your all tablets, nutritional supplements. You should be able to assess nutritional status of older adults, including risks from medications. यहाँ क्रॉस 50 क्रॉस किया नहीं आजकल मीनोपॉज live besides 50. Generation before us, most of them got menopause at 50, 55. But now people are not even reaching 45. Early menopause, stress, over medication, stress, younger adults, not older, people from your age group. सिर दुखा, नींद पूरी नहीं हुई, टेस्ट में मार्क्स कम आए, कंपटीशन का डर है, हेडेक है, चलो एक गोली खा लो. एसिडिटी हो गई, मेस का खाना अच्छा नहीं है, बाहर से खाना मंगाया, ढाबे से, हाइजीन कॉम्प्रोमाइज्ड, लूज मोशन हो गए, चलो दवाइयां खा लो. स्ट्रेस, एनर्जेटिक्स खाए, एसिडिटी हुई, तो अब तो एंटीसिड खाना ही पड़ेगा. Sadly, this process of deterioration has started too early in life, in today's life. So you should be able to assess nutritional status of older adults, including risk for medications. 50-60 की उम्र तक पहुंचते पहुंचते सारे मम्मी पापा कॉम्बी फ्लैम तो खाते ही खाते और एंटासिड भी रोज ले लेते. You should appreciate the importance of functional assessment of older individuals. Environmental factors do contribute to it. Pollution है, गाड़ियों का धुआं and all that. पर जो अपने हाथ में है, हम वो भी ठीक नहीं कर रहे हैं. स्लीप वेक साइकिल ठीक कर सकते हैं, नहीं कर रहे हैं. स्ट्रेस कम करने के लिए योगा नहीं कर रहे हैं. टेस्ट इतना इंपॉर्टेंट हो गया है कि फाइबर एक नुस्खा बन के रह गया है and not the main diet. So many things we have changed, and few people will agree to it, few may not. That multimedia, TV, radio, cinema, all these factors have also played important role. People learn, children learn from what they see, and they make movie heroes, their own heroes, they try to imitate them. In trying to do that, lots of damages are still done. What's normal? Aging physiology that is clinically expected. Normal aging physiology is something which is very difficult to follow. But if somebody can do that, that would be wonderful. Now, here is the graph between age in years and present remaining, and the factors which are included are conduction velocity, your BMR, your standard cell water, cardiac index, your standard GFR, vital capacity, standard renal plasma flow, your MBC, that is maximum breathing capacity. It covers all the systems: CVS, renal system, respiratory system. So all your vital capacities, vital functions. These factors, how they decline. This has been shown in the graph. Overview of aging physiology. What are the factors? Skin, where you see and say ki you are aging. Who is aging normally, or who is aging rapidly, or who has defeated aging? What are those factors, those characteristics at which you can look and comment? Skin, body composition, vision, special senses, nervous system, musculoskeletal system, renal, not to forget digestive system, because ultimately all the nutrients, they enter bloodstream from this only, and this carries a lot of burden like a cart. And of course, the most crucial, cardiovascular system. We'll go one by one. Now, the body composition. This graph shows that how much fat, how much bone, how much cell mass, and other factors like water and other nutrients that you have. Fat, cell mass, bone, your skin, muscles, blood vessels, nutrition. Now, age 25 and age 70 clearly shows the difference. Your fat metabolism starts slowing, so it starts depositing. Fat is less at 25 and increases manifold at 70. Cell mass is more, but like I said, at cytological level, your telomerase decreases, so the tail of cytoplasm or telomere starts damaging, and ultimately the cells start dying and cell mass decreases. Bone is variable. This graph shows usual, but that usual trend has also been rapidly changing, and I'm sure it's come down further. Special senses are affected. Vision. Majority wears glasses. or contact lenses. And not only near and far vision, adaptation is also diminished, markedly diminished. In fact, that's the first thing to go. Hearing, you start demanding loud voices, loud notes. Hearing becomes difficult and impaired with age. Taste gets altered. It's very tricky and very sometimes quite, I must say, tricky only that the taste buds they diminish. They don't. People stop enjoying. Old people they normally stop enjoying the taste with the same amount of spices or ingredients and start demanding for more. On the contrary, their digestive system has gone weak, which is not able to digest even the normal spices. But to satisfy taste buds, थोड़ा और डाल दो, थोड़ी और मिर्ची डाल दो, थोड़े और मसाले डाल दो. तो ये सारा कुछ डैमेज करता है बेटा. Smell. You don't even get to know that you are smelling bad. This, your sinuses get blocked. हर जगह पे जो एक्टिव सेल्स है सेंसेस पकड़ने वाले उनकी गिनती कम होगी तो नेचुरली ये सारे फंक्शन के ऊपर असर पड़ता है. Smell, the statistics say that it decreases by about 50%. पानी जरूरी है तो मेटाबॉलिज्म स्लो हो गया है भले ही but metabolites need to be thrown off. Your system needs clearance. Unfortunately, your thirst drive decreases. There is impaired control of thirst by endorphins. Thirst is a very, very protective, defensive feature. You drink water, you save your system. But when this drive decreases, you don't even know that your body needs water. So that's why any oldie in house, whether they feel thirsty or not, उनको थोड़ी थोड़ी देर में पूछते रहना चाहिए कि माँ जी पानी पी लो या पिताजी पानी पी लो, पिलाते रहना चाहिए. Give them liquid. They will not notice it. Lens opacity starts increasing. They say it yellowing. There is impaired dark adaptation. There's inability to focus on near items. Adaptation, as I said earlier, presbyopia, it decreases. Contrast sensitivity also decreases. Lacrimation decreases. This that creates a need for eye drops. Dry eyes. आईज को न्यूट्रिशन अंदर से ही मिलती है. जब ड्राई आईज होंगी तो यू हैव टू गिव सम सप्लीमेंटेशन बिकॉज ड्राई आईज दे गो फॉर द डैमेज वेरी रैपिडली. दे फॉल प्रे टू इट. CNS, the headquarters. Intellectual capabilities are maintained in most of the people till the age of 80. Slowing starts mainly in central processing. दिमाग के different brain के different parts में different information stored है. Coordination से आपकी performance होती है. वो central processing जो in house होती है it becomes slow. It the tasks take longer to perform. वो काम जो 5 मिनट में होता था 15 मिनट में भी स्ट्रेस के साथ एफर्ट करके होता है. It happens. And the wisdom lies in accepting it and changing yourself, your expectations according to it. Verbal skills, they are maintained until the age of 70. Gradually, there is fall in vocab, there is increase in semantic errors and abnormal prosody. Interesting enough that whenever your stored information is difficult to recall, your recall becomes delayed, people start inventing new vocab, new words. And this is good in a way. New vocab should be there. This should be a continuous process. Why should dictionary stop at where it is today? After all, these words were also designed by some human beings. And why can't we add few more to it? So whenever you are not able to recall effectively from your memory, people do start making new words, which is a very interesting part of this deterioration. Mentation. There's difficulty in learning new things. Even though I have read, and I'm sure you also must have read at net, Google May, okay, there are few people who started their life at 68 or 70. They learned new languages. Ultimately, finally deciding factor is CNS, your will, your desire. So don't let your desires die. But for an average life, mentation does get affected. Learning becomes slow, especially new languages, forgetfulness in non critical areas. It doesn't impair recall of important memories or affect the function. But this is natural. Like you have a limited number of bins in your brain which will store information. Now, when they are full and you want to store new information, you have to empty, you have to vacate the previous one. That's quite natural, and it should not be considered a negative feature. PNS or peripheral nervous system. Spinal motor neurons go down, nerve conduction slows, vibratory sensation, especially of feet, it decreases, warm cool sensation decreases, size of large myelinated fibers decreases. I've seen in my own home that my grandmother, she used to sleep so many times without, even in the rainy season when it's mild cold, without putting anything on herself. She used to say, I'm comfortable. I'm not feeling cold. But in sleep, we saw her shivering and we used to put some bed sheet over her. She used to be comfortable. So here the thermal sensitivity, the body needs it, but the sensation decreases. They don't feel cold. Feeling is a very important factor. It protects you, it saves you from the damages. You feel pain when you put your finger on fire on a hot pan. It's the feeling that prompts you to withdraw your finger. You touch a hot cup, your fingers burn. It's the feeling of heat that prompts you to hata lo. So when this feeling becomes less decreased or poor, this protective phenomenon goes down. So warmth and cool feelings, the thermal sensitivity decreases, and this is because there is decrease in size of large myelinated fibers. Again, the damage is at cytological fibers. टेलीमेरेज कम हो गई, टेलीमेरेज खत्म हो गए, क्रोमोसोमल डिवीजन कम हो गई, एंड फाइनली diminished number of cells. Immune system. One falls more prone to infections, autoimmune disorders, cancer, the most deadly today, not only the most, but one of the most deadly diseases today. Immune system decreases, and all these factors, they overpower you. Cell mediated immunity decreases. There is lower affinity, low antibody production, delayed type of hypersensitivity decreases, interferon gamma increases, TGF beta, TNF, IL-6, IL-1 production, it causes impaired macrophage function. Now, this is like domestic war. All of you have seen this first and second phase of COVID, and you must have come across the word cytochrome storm. I compare it with a domestic war. Suppose there is domestic rift and it goes out of control. Your local police is not able to control. The central government orders military to take over. Then military doesn't see कि कौन है, सीधे शूट करती है. उस शूटिंग में ना सिर्फ टेररिस्ट बट के नॉर्मल सिविलियंस भी मरते हैं. This is cytochrome storm. That when they take over, when these दबंग लोग when they take over, ये बहुत सारे डिफेंसिव फंक्शंस को इम्पेयर कर देते हैं, and your own normal tissues get damaged. IL-6 लेवल बढ़ जाते हैं, IL-2 रिलीज डिक्रीज हो जाता है, रिस्पॉन्सिवनेस डिक्रीज हो जाती है, बी सेल्स बाय बोन मैरो स्लो हो जाते हैं, कम हो जाते हैं. And all these factors result in immunity contributing decrease in immunity, and ultimately leads to susceptibility to infections and malignancy, increased susceptibility to infections and malignancy. Visual factors. Macular degenerations, cataracts, visual acuity कम होती है, dark adaptation slows gradually, peripheral vision, it also gets suffered, contrast sensitivity, accommodation, all these features, they do get affected, they do deteriorate. Special senses. Another factor is auditory and vestibular. Hearing and maintaining balance. Presbycusis. This is high frequency hearing loss. Age related, normally जो आवाज सुनाई देती थी उसकी क्लैरिटी कम हो जाती है. You must have seen घर पे ओल्ड इज सेइंग, जरा ऊंची बोल, क्या बोल रहा है? वो म्यूजिक जो लो वॉल्यूम पे एंजॉय होता था, कोई पुराना फेवरेट गाना आ जाए दादा दादी का, तो पीछे पड़ जाते हैं कि जरा हाई वॉल्यूम कर दो, सुनाई नहीं दे रहा. दिस इज नेचुरल. Vestibular dysfunction. Most of the traumas, most of the disasters occur when there is change in position. इसीलिए बोलते हैं कि घर में किसी बड़े को हड़बड़ा के मत उठाओ. When they are sleeping and they get up suddenly, their equilibrium system has gone down. They need time. Change of position from lying down to sitting, from sitting to standing, or standing to sitting. Even taking side, changing side, everything, it needs instant balance, instant equilibrium. And this vestibular function, it decreases. So, again, I repeat, it's wise to accept this factor with age and adjust and adapt according to it. Smell decrease हो जाती है. Teeth, 40% of elderly are edentulous. टेस्ट सलाइवरी फंक्शन तो जाता ही जाता है. दांत भी बहुतों के नहीं रहते बेटा. Now, to most of us, the condition of skin, hair, and connective tissue, they collectively represents the ultimate indicator of age. लोग बोलते हैं कि देखो ना तुम्हारे एज, तुम्हारे चेहरे से लगता नहीं कि तुम 60 की हो. You still look 30s. So this is something which people see, which you present yourself. Unfortunately, यहाँ भी चेंजेस होता है. जो सेल्स डिक्रीज हो रहे हैं, डैमेज हो रहे हैं, वो सब जगह के हो रहे हैं. बाल सफेद हो जाते हैं, स्किन कटर्गर लूज हो जाता है. सो बट स्टिल दे से दैट if your mind is pure, your thoughts are clear, you have a good heart. Heart means your thinking, your thought process, your mind is free from most of the negativities. I will not say all because we are human beings and everybody is born with some faults. So can't expect a perfect picture from anybody. But if by and large you are free from most of it, even with all these factors, you look beautiful. Now here is, you see, the skin at 24 and 54. These days, with makeup, with so many professional advances, this is the picture has changed. But the usual ish are not following this. For the most of them, the changes are really very unpleasant. Wrinkling. Muscles of the face are capable of tremendous movement. Smiles, laughter, frowns, disappointment, anger, rage, and surprise. They're all recorded. Hand of time captures these expressions and outlines them on the face. And by the age of 40, most people, not all, but quite a few of them, they bear typical lines of their expressions. There's increased vulnerability to pressure sores. With increase, there's loss of subcutaneous fat. There is less insulation of body to cold. It is also affected by decreased blood flow to skin and extremities. Pressure sores for two reasons. One, with age, your BMR decreases. your activity decreases, and a lot depends on social and culture factors also. In Indian systems, where you become mother-in-law and father-in-law at the age of 50, 45, or 50, and your daughter-in-laws and sons, they take over. Your physical activity, your stress as such decreases. Decreased blood supply makes you more vulnerable to pressure sores. These are few more features which have been recorded. In skin, there are epidermal changes, Langerhans cells, melanocytes, they both decayed, they diminish, and the density doubles on sun exposed skin. So the undesired factors increase and desired factors and responses decrease. Collagen decreases. There's people say that there's 1% annual decline. Altered fibers. There is progressive loss of elastic tissue in papillary dermis, which is a very important factor in wrinkling. Now, there is physiological deterioration, and what are the consequences? This table clearly explains. Decrease in barrier function, dryness, slow cell replacement. Remember my point. Start showing, don't lose your interest in life. Love yourself. Don't confuse with ego. Like yourself. And you should have desire to live. Then only your telomerase will be activated. And if your telomerase is activated, your telomere will be regenerated. So slower cell replacement leads to rough surface and delayed healing. But if you follow this advice, probably this can be postponed. Ineffective DNA repair, increase photocarcinogenesis, इलास्टिसिटी कम होती है तो लैक स्किन ब्यूटी पार्लर की फेशियल्स एंड ऑल दे डू टेक केयर बट इफ यू आर फॉलोइंग अ हेल्दी लाइफस्टाइल this is automatically nature takes care of it. Immunologic and inflammatory responsiveness decreases, so the chronic low grade skin infections, fungal infections, कहीं eczema, कहीं पे itching है, कहीं पे छोटे छोटे पित्ती निकल आए कुछ inapparent injuries and infections, scratches, bruises, बहुत सारी चीजें शुरू हो जाती हैं. There are atrophic changes in sweat glands, thick fingernails and toenails, generalized loss of body hair and head hair, decrease in functioning pigment producing cells, number of functioning pigment producing cells. So the graying starts. Graying, thanks to the stress of today, has started as early as 20 years in today's life, which is a very sad part. Thanks to pollution and thanks to the commercialization. Some remaining pigment cells they enlarge, which are called age spots. Skin changes, they increase vulnerability to infections and disorders also. Nervous system factors. CNS. There is decrease in nerve cell number. There is basal ganglia atrophy, decrease in dopamine, which increases and an increase in muscle rigidity, step height decreases, reaction time increases, and there is decreased vibratory sensation. 30% loss in muscle mass. 30 to 70 or 80. So this is called sarcopenia. Osteoarthritis, which precipitates many other problems. Weight bearing organs, joints, spines, knees, metatarsals, phalangeals, all these areas, they ultimately get tired and they succumb, they surrender to your requirements. Repeated strain, distal interphalanges, carpometacarpals, joints, small or big, they all ultimately start showing revolt, get inflamed. And this osteoarthritis leads to many other problems because it reduces your activity. You who used to dance at early age, now you're not able to do that because घुटना ही नहीं उठ रहा, मुड़ नहीं रहा. डांस के लिए जो एक्शन चाहिए, हाथ ही नहीं, हाथ कंधे से ऊपर नहीं जा रहा. Osteoarthritis is one of the major disaster disastering factor in aging. Osteopenia or porosis, 80% women at the age of 60, 65, they suffer from it. Rather, I would say in today's time, this age has come down. There is decreased activity, so calcium, estrogen, everything goes down. Skeletal-muscular system changes, arthritis, allied bone and muscular conditions are among the most common of all disorders, affecting people of 60 65 years age. Arthritis, it's inflammation of joints. It's a term that refers to an inflammation or degenerative change in a joint. It occurs worldwide and is one of the oldest known diseases. Cause exactly not known, but it's degenerative joint disease, gradual wearing away of joint cartilage that results in exposure of rough underlying bone ends. So when those rough underlying bone ends, they get rubbed against each other. They face friction, they start damaging. And this can do damage to internal ligaments also. Most commonly, it's associated with weight bearing joints like knee, hip, and feet. Rheumatoid arthritis, well known entity to everyone. It's a chronic systemic inflammatory disease of connective tissue, 2 to 3 times more common among women than men. And currently, it's considered as autoimmune disease. It may occur at any age, but most common onset is between 20 and 50. Renal physiology. Now, here the GFR decreases 30 to 46%. Tubular function decreases. Renal plasma flow decreases. And this is the formula to calculate. Main GFR, tubular function, and plasma flow decrease. Besides this, the permeability of parenchymal cells also decreases. They could get thickened, so the clearance of creatinine and urea also suffers with age. Ultimately, you die. Leading cause among OAs is heart disease, higher for older men than for older women, higher for African Americans than whites, but in India, it's higher in women. Skeletal muscle undergoes changes as we age. The reduction in bone mass and bone density condition predisposes an individual to fractures, vertebral fractures, femur, distal radius. This is mainly due to osteoporosis. Bone mass decreases so many times in families or around in your surroundings. You must have heard cases where कि वो दादी जी वॉशरूम गई उठी तो एकदम से कड़ाका बोल गया और हड्डी टूट गई. This is because change of posture, which requires weight bearing capacity, that is sometimes not accepted by the body when your bone mass is less. Osteoarthritis is degenerative joint disease. This is the second most common cause of disability in US, affecting more than 50 millions of Americans and much more than that in India. Muscle fibers कम हो जाती हैं, muscle mass कम हो जाता है, lean body mass decreases, there is infiltration of fat into muscle bundles. Now, BMR decrease होगा तो बेटा फैट डिपोजिशन शुरू हो जाएगा. फैट डिपोजिशन शुरू होगा तो मसल मास ऑटोमेटिकली कम होगा. You easily get tired, your work capacity decreases, that is, fatigue becomes more prominent. BMR decreases. Bone density decreases, both trabecular and cortical. Osteoclast bone formation decreases. Bone remodeling decreases to a large extent. Adipocyte formation in bone marrow. This increases. So something which is undesired, it increases. There is slower healing of fractures because the vitamin D absorption decreases. Osteoblasts कम हो जाएंगी, bone formation कम हो जाएगी. आजकल धूप में तो कोई नहीं बैठता. Bone loss increases, loss of height, that is stooping, and there is that leads to dorsal kyphosis. Your posture also changes. Bone density, micro architectural bone deterioration is very prominent feature of osteoporosis. Gradual loss of bone that reduces skeletal mass without disrupting the proportions of minerals and organic materials. This is when osteopenia leads to osteoporosis. For many, it's asymptomatic, and bones most critically involved are vertebra, wrist, and hip. Loss of muscle mass that occurs with aging, cause still not completely understood. Now, some say it's preventable, reversible, if you increase your physical activity and you do right type of exercise. And this is advocated by you, our Indian system of yoga also. GI system, there is atrophy of secretion mechanisms, diminished motility of gut, loss of strength, tone of muscle tissue, and supporting structures. There are changes in neurosensory feedback, enzyme and hormone release, innervation of tract, diminished response to pain and internal sensations. All these factors which are instrumental in digestion, they decreased. Innervation also starts deteriorating. Now, referral is a very common feature in GI symptoms. The signs and symptoms which are often associated with one part of tract, they may actually be associated with another part of tract also. Discomfort perceived as originating in stomach may actually be coming from the lower GI tract. You haven't passed motion, you are constipated. There are a lot of gases. They distend your abdomen. The back pressure goes ultimately, and you feel there is something wrong in stomach and no gas stadgi, which is commonly called gas. So this misperception or this referral phenomenon is very common in GI symptoms. They often have their origins in psychosocial factors also, because GI symptom digestion is to quite a large extent controlled by your mental status. Now, what are the age associated changes and what are the possible disease outcomes? When liver size decreases and the blood flow decreases, there is naturally impaired clearance of drugs requiring phase 1 metabolism. लिवर फैक्ट्री है जहाँ पे सारे के सारे ड्रग्स सारे मेटाबोलाइट्स सारी चीजें मेटाबोलाइज होके सारी गंदगी बाहर निकलती है दैट डिक्रीजेस they keep on circulating in your blood and keep on damaging your tissues. Impaired response to gastric mucosal injury, there is increased risk of ulcers. Pancreatic mass and enzyme reserves कम होंगे तो इंसुलिन रेजिस्टेंस बढ़ेगी. कॉलोनिक कॉन्ट्रैक्शंस कम होंगी तो कॉन्स्टिपेशन बढ़ेगी, गट मोटिलिटी कम होगी, constipation and once constipation sets in, it invites so many of its friends, which add to symptoms worse than this. Fissures, fistula, piles, so many things. Decrease in gut-associated lymphoid tissue, it leads to increased risk of gastric and duodenal ulcers. GI absorptive cells कम हो जाते हैं, GI motility कम हो जाती है, sphincter activity reduces, blood flow decreases, gastric acid secretion decreases, and active transport also decreases. Now, cardiopulmonary system. In absence of disease, the heart tends to maintain its size. Heart walls, they tend to increase in thickness with age. BP tends to go up. Systolic stabilizes at about 75 and diastolic at about 65. Then they may gradually decline. Postural hypotension, a fall in systemic blood pressure upon rising from a supine to standing position. This causes lightheadedness when a person stands up and can thus increase the risk of falling. Atherosclerosis, development of fatty plaques and proliferation of connective tissue in the walls of arteries. This can lead to blockage of artery and dangerous when it involves myocardial, when it involves coronary arteries. In vascular intima की size बढ़ जाती है, so that's early stages of athero. Vascular stiffness बढ़ जाती है, stroke, athero and systolic hypertension. It leads to left ventricular wall thickness or hypertrophy. Decreases early diastolic cardiac filling, increasing cardiac filling pressure, and it lowers the threshold for dyspnea. You become dyspneic at a very low threshold. Compensation की capacity कम हो जाती है. Increased left atrial size atrial fibrillation. Altered regulation of vascular tone. Vascular stiffening, hypertension हो जाता है, decreased cardiovascular reserve, lower threshold for and increased severity of heart failure. There's high prevalence of anemia, B12 absorption because GI system का mucosa absorption कम होएगी, B12 अल्सर्स बढ़ जाते हैं तो बेटा B12 absorption कम होती है, pernicious anemia and red cells also decrease. Vascular smooth muscle also is not spared from this damage. There's increased thickness of intima and media in blood vessels, collagen deposition, increased fibronectin, cross-linking, fragmentation of elastin, calcium deposition, all these factors, they ultimately they reduce motility of vascular muscles and they reduce their functions. So net result is increased vascular stiffness. Age-associated change in cardiovascular physiology is maintenance of resting left ventricular function, decreased ability to compensate for stress or impaired left ventricular function, blunted heart rate response to exercise, which needs a compensatory increase in stroke volume to maintain cardiac output. Athero versus arteriosclerosis. Atherosclerosis is developed by overwhelming number of people in industrialized nations, a narrowing of arterial passageways as a result of development of plaques on their interior walls. It reduces the size of passageway even to the point of closing it off, a cause of ischemic heart disease. Arterio, this is a generic term referring to the loss of elasticity of arterial walls, often called as hardening of arteries, and it's a normal aging phenomenon. Development of fatty plaques and proliferation of connective tissue in walls of arteries is called atherosclerosis. Very important role it plays in aging. Now, respiratory system. COPD and lung cancer. COPD, it not only attacks you when you are exposed to polluted environment, but even living in a good environment as a normal routine of aging, it comes. But with ideal lifestyle, it comes late. There's the difference. It comes late. And in polluted environment, it comes at half the age. These are the steps which lead to emphysema. It begins when the cigarette smoke irritates the respiratory tract, stimulating proliferation of WBC called white cells, which are macrophages. Elderly bronchitis is common, very common, especially those who have history of cigarette smoking. They are more prone to these changes. Now, in pulmonary parenchyma, alveoli, breathing capacities, very clearly the difference, the transition from younger to older age is rapid and more disastrous in cigarette smokers or people working in mines and polluted areas. Alveoli lung capillaries कम हो जाती हैं, elasticity of parenchymal elastic tissues कम हो जाता है, elastic recoil reduces, airway size, ciliary actions, chest wall stiffen हो जाती है, ciliary action और airway size कम हो जाता है, lung mass reduces, Respiratory muscles weak हो जाते हैं, like other muscles, and diaphragm also weakens by 25%. Now, this graph, it shows the age-related loss of lung function. Have a look at it, and the figures will clearly explain what I already said, what I've already explained. FeV1, FVC reduces residual volume, बढ़ जाता है, ventilation, perfusion, mismatch, it causes reduced PaO2, maximum inspiratory and expiratory pressures decrease, CO diffusion decreases, and ventilatory response to hypercapnia also decreases. Airways and tissues become less elastic and more rigid with age. Osteoporosis may alter the size and shape of chest cavity. Power of respiratory and abdominal muscles become reduced, which hinders diaphragmatic movement. Genitourinary and endocrine systems, kidneys, bladders, pituitary, thyroid, adrenal, testes, ovaries, they all undergo slow and gradual deterioration in their functions. Bladder capacity decrease हो जाती है, and residual urine which stays in bladder, that increases. It happens, you must have seen that in elderly people, even when they go to pass urine, they take more time. A sense of dissatisfaction is there when there is incomplete evacuation, and it requires more time and multiple attempts to evacuate. Micturition reflex is delayed, usually activated when bladder is half full, and not until the bladder is nearly at capacity. The renal system, this is characterized by a number of age-related changes in physiology and anatomy. Very few age-specific disorders are associated here, with the exception of declining level of testosterone. Most of the problems of sexuality and aging are sociogenic or psychogenic. External genitalia, folds in females, they become less pronounced, skin thinner, vascularity, elasticity decreases, they become more susceptible to tissue trauma and itching. Glands decrease, so does the level of secretion. Uterus decreases in size, becomes more fibrous, has few endometrial glands, cervix reduces in size, tubes become thinner, ovaries take irregular shape, ovulation stops, there's the menopause. Male genital system, it continues to produce germ cells and sex hormones well into old age, declining with advancing age. Size and firmness of the testes decrease. Reduced sperm production due to age-related fibrosis. This constricts the blood supply, and fibrosis also affects penis, since erection is purely vascular phenomenon. Now, you have to distinguish usual from, whenever you are talking about aging, you should concentrate on differentiating between usual and successful aging, major age associated changes in human physiology. You should try to understand anti aging effects of exercise. You should be able to assess nutritional status of older adults, including risk for medications, and you should be able to appreciate the importance of functional assessment of older individuals. As at your age, the good health is pretty much a thing of past. My advice is find an illness that you enjoy. That's it. Any questions you have, you're most free to ask. Thank you. Thank you very much.